Good afternoon. I'd like to call the Human Service Committee to order. I'm Jan Burt, Chairperson. Please join me in the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Can we have roll call, please?
Mrs. Burdick.
Here.
Mrs. Ricketts-Wales. Mr. Barnes.
Present.
Mr. Bissett. Mrs. Hanchett.
Here.
Mr. Healy.
Here.
Mrs. Root.
Here.
And Mr. Harris. 5 present, 2 absent, and we do have a quorum.
Thank you. And can I have a motion to approve the agenda as presented?
Root will make it.
Healy, a second.
All in favor?
Aye.
And that's carried. And then we need a motion to approve the minutes of September 17th, please.
Hanchett will move.
Root will second.
Any corrections or additions? All in favor?
Aye.
And that's carried. We'll start today with Anita Madison, Director of Office for the Aging. Welcome, Anita.
Thank you. The first thing on our agenda is the monthly report. A couple of things I just wanted to highlight. If we look at the 2024 total versus the 2025 total, if we go for the entire year, for the telephone calls at the front desk, last year at this time, we had 13,743 calls. Right now, we're at 16,514 calls, and that's as of this monthly report, which is in August, and the calls are increasing. The other thing I'd like to highlight is the waiting list. So for our Go and Dine program, we were able to remove all 23 individuals who were on the waiting list and put them onto the program. So right now, we have no waiting list for the Go and Dine program.
Do you have any explanation for the increase in calls?
Well, for right now is the first day of open enrollment. So Medicare is a little crazy this year, and we'll go through a few highlights at the end. But our calls primarily right now are caregiving and insurance,
Okay, thank you.
and heating with HEAP being open.
Okay. And I see you're advertising for people to help with the tax, or is that the health insurance counselors?
We are looking for tax volunteers
Okay.
to be a tax preparer for our tax program, yes.
So if anybody's interested, contact your office, right?
Please do so, yes.
All right. Anything else, Anita?
Not for my monthly report.
Okay, we can move on to the agreement amendment.
So the first item out on the agenda is we're requesting a resolution to approve an agreement modification to our Exhale agreement with the Alzheimer's Association. This agreement, or this modification, extends the terms of our current agreement from September 30th, 2024 to end with the new modification of March 31st, 2026. It also pivots the designated funds within this agreement from purchasing tablets, which is what the Exhale was supposed to be for originally, and it expands it to cover the cost of the PRI and screen, which is the screening that is required for an individual to enter into a facility-based respite, and also for transportation support services for respite services for caregivers.
Can we have a motion?
Healy will move it.
Second?
Hanchett will second.
Any questions? All in favor?
Aye.
And that's carried. Thank you.
Thank you. Next, we are asking for a resolution to approve an amendment to the original contract, subcontract agreement with the Alzheimer's Association from July 1st, 2022 to June 30th, 2027. This amendment is where the grantor is asking or has issued an amendment to clarify and formalize requirements pertaining to the timing of vouchers and submission for reimbursements for the grant. There is no other changes to the scope of services, the total contract amount, funding source, or any other deadlines. In the original agreement, we didn't have a time frame for vouchering and for a final invoice, and this amendment just puts dates on those requirements.
Root will make a motion to approve.
Healy will second.
Any questions?
It's just like, there's no fiscal impact associated with this amendment, is it correct?
Yes, the grant is the same. It's really, before we didn't have any timeframes And they did put in that a final invoice would have to be submitted by July 31st, 2026 as part of the amendment.
So there's no county funds?
No.
Now, on your previous one, let me back up to that too, because it says 122.9, and revenue's been budgeted across 25 and 26 county budgets. Is that county money, or is that, no, that's other funds coming, grants or whatever that?
Yep, it's all within the Alzheimer's Caregiver Support Initiative
But
grant.
that wasn't clear either in that MOE, so thank you for clarifying that, and we'll proceed with this, thank you.
Yep, thank you for identifying that. I can make sure going forward that that's clear on the MOE. Yep.
Any other questions? All in favor?
Aye.
And that's carried. And I believe you have one more?
So the last one that we have is we are asking to authorize to transfer funds within the unmet needs budget to ensure adequate funding is available to cover contractual travel expenses in the 2025 county budget. Our office anticipates contractual travel costs resulting in the new contract with GoGo Grandparent Technologies Incorporated. Sufficient funds are available within other line items within the unmet needs budget, and we're just looking to transfer the funds to accommodate. So we are looking to move $20,000 from mileage over to the contract line.
We have a motion to accept that.
Hanchett will move.
Second? Any questions? All in favor?
Aye.
And that's carried. Thank
Thank
you,
you.
Anita. Anything else you want to add today?
I would like to just make a comment. So today is October 15th, which is the first day of open enrollment for Medicare beneficiaries. This year, we have at least 1,400 older adults or Medicare beneficiaries who are receiving letters that their plan is no longer being offered in Allegheny County. This is in addition to anyone else who is looking to make a change to their current plan, or make sure that their plan will work for them next year. So we are already full for all of our insurance counselors all the way till December 7th. Of the 1,400 people that we know of that are receiving those letters, they have until December 31st to choose a new plan. So it is not the December 7th deadline for those individuals. It gives us a little bit of extra time. December 31st is the deadline if you received a letter saying that your plan is no longer being offered. We do have our insurance fair coming up, which is Friday, October 24th from 9 to 2 in the office next door to us. We are almost at capacity with that as well. So we are right now taking names, putting people on call list, working off the call list, working with the New York State Office for the Aging to send names to them to help with the insurance counseling, and then people can call 1-800-MEDICARE if they would like to as well. There are trained insurance counselors there. But I just want everybody to make sure that if you have a Medicare plan, please open your mail, and please look to see what your plan looks like for next year.
Thank you, Anita. Anybody have any questions about that? If you do, contact the office if you can get through.
Yes,
Thank you, Anita.
thank you.
Good luck. Next, we have Tyler Shaw, Public Health Director. Welcome, Tyler.
Good afternoon. Just a couple highlights on the monthly report. You'll see our medical services are up. We do have our new nurse practitioner who is rocking and rolling. So you'll see those numbers continue to increase. And our children's services referrals are down, which is not surprising for September as school is just starting back in session. So we should see those referrals tick up a bit too over the next quarter. In your packet also on the monthly report, you'll see a little picture. We distributed about 3,500 of these to local businesses as placemats to highlight our initiative for our HUD grant, which is replacing and repairing lead homes that have children that have been lead poisoned in them. And I did want to, that's a nice segue for me. I just wanted to update, a few months ago, we requested to apply for the next round of HUD funding with Cattaraugus County, and we were awarded $4.4 million with Cattaraugus County. Our share is going to end up being about $1.2 million over 4 years. So continuing on with that project, and the actual work for repairing and replacing some of these items for homes will actually begin next year, May 1st, 2026.
That's good news.
Yeah.
All right, I guess you can anything else on monthly report, or you can move right on to your...
That's all for me.
Okay.
First up is the Accord MOU for our early intervention program. We do partner with them for using their Head Start program to screen children for early intervention.
Can we have a motion to accept this?
Hanchett will move.
Root will second.
Any questions? All in favor?
Aye.
And that's carried. And the next one for...
Next up is Atupa. It's our Lamar billboard contract. I think in your packet is also the draft of what the proposed billboard would look like as well.
Haley will move it.
Get a second for that?
Hanchett will second.
Any questions? All in favor?
Aye.
And that's carried.
Next up is our early intervention, or EI admin grant, and we did see just a slight increase in funding, but this is a recurring renewal of a grant contract.
Root will make a motion to accept.
Purcell, second.
Any questions? All in favor?
Aye.
And that's carried.
Next up is our annual Healthy Families MOU, which is, again, just a referral between our department and the Healthy Families Allegheny Cattaraugus program.
We have a motion for this one.
Purcell.
Second?
Hanchett will second.
Any questions? All in favor?
Aye.
And that's carried. And the next one, Tyler?
Next up is our preschool. I am requesting a contract for related and evaluation services with Dina Hess. The only correction in your packet is the mailing address. I spelled Brooke like the name Brooke, but there's no E at the end, so I apologize.
Haley will move it.
Root will second.
We'll forgive you. Any questions? All in favor?
Aye.
And that's carried.
Next up is our statewide health information network for New York participation agreement. We use this agreement, so in any individual that seeks medical care that may come to our clinic, we can see some of their medical record notes, or if they're being treated for an STI or some other communicable disease, that's typically what we're using this for. This is a statewide initiative. We just happen to be in this Rochester regional, it's called the Rochester Rio.
Motion to accept.
Haley will move it.
Any questions? All in favor?
Aye.
And that's carried.
Next up is a contract with Vaneski and Company to complete our Diagnostic and Treatment Center cost report, and this will be for the years 25, 26, and 27.
Motion
Root
to
will make
accept.
the motion.
Second?
Hanchett will second.
Any questions? All in favor?
Aye.
And that's carried. We're getting there. Two more. Three
Two more.
Two more.
Next is a renewal of our WIC grant, and you can see there it's $493,800 a year.
Haley will move it.
Purcell, second.
Any questions? This is locked in, this amount, right?
This is locked in, yes.
All in favor?
Aye.
And that's carried. And then one more.
One more is our MOE to accept and appropriate our Year 12 performance incentive monies. You'll see how I plan to appropriate those funds. You'll see a lot of office equipment in there that we're really trying to save on some of our budget for next year. We're replacing some of our computers and some of our environmental health staff's iPads this year in the budget.
Can we have a
Hanchett will
motion?
move.
Root will
Second.
second.
Any questions? All in favor?
Aye.
And that's carried. Anything else you want to talk to us today about?
That's all.
Thank you, Tyler.
Thank you.
All right, next we have Don Horn from DSS, Department of Social Services. Welcome, Don.
Good afternoon. On the monthly report, it's pretty normal. I would just like to bring your attention on page 1 to the total number of homeless placed. That dropped. In July, we had 35, and in August, we're down to 19. We were successful in moving a family out of state that came in from out of state. And we were very successful in finding some of the homeless people permanent housing. So we got to move them out, so. And then on page 2, under the program integrity unit for fraud, repayment agreements without prosecution. We were successful in getting 11 people to admit that they did perform fraud and agreed to repay the department for the fraud. So,
Very good.
any other questions on the monthly report?
All right, if not, we'll move on.
Okay.
Before we approve this, do you want to explain why you need to fill this position?
Sure.
Is that a good entryway into what you want to tell us?
Yep, okay. We will be asking for an employment specialist. The reason being, as some of you may have seen in the Wellsville Sun this past week, there was an article about ABOD requirements from the One Big Beautiful Bill. And New York State had a waiver that exempt us from having to have people who qualified for SNAP, food stamps, to have to perform work requirements. That was going to last until February of '26. That waiver has now been canceled by USDA. So we were notified mid-last week that we will start to institute ABOD requirements for SNAP benefits immediately. We are getting plans in line so we can cover the requirements that we need to cover. Approximately right now, we have 225 clients that are identified as ABOD that will have to do the work requirements. We will be sending letters out by the end of the month to notify them of the requirements that they will have to do, or if they are going to seek an exemption so they do not have to do the work requirements and still receive their benefits. These people were identified in the state system from the old ABOD requirements by a code that we put in the system when we do interviews for everyone that receives SNAP benefits. So that's where we came up with approximately 225 people that we have to come right out of the gate on. The other people who are on SNAP benefits, when they come in for a recertification, if they weren't identified under the old ABOD eligibility requirements, they will be screened under the new requirements to see if they have to do work requirements under the ABOD regulation. For those people, the 225 we approximately have, every 3 years, New York State has a recertification period with USDA. Within that period, everybody who comes in that applies for SNAP benefits automatically gets a 3-month waiver. That 3-month waiver for the people that are identified right now will begin on December 1st, if they're not exempt. So they will have 3 months to either find employment or comply with the requirement for the ABOD regulation. That'll start December 1st, and then some of the ages were changed. The old age limit was 18 to 54. The new age limit will be 18 to 64. Some groups were exempt automatically: veterans, homeless individuals, and former foster care youth. They are no longer exempt. Any child under 18 that was in the home that was being cared for by an adult, that home was exempt. That has moved down to 14. If you had a child in your home that was under 18 that you cared for, under the old regulation, you did not have to do the ABOD requirement. They moved that age from 18 down to 14. So you have to have a child that's under 14 within the home. And then there is a list of exemptions for ABOD requirements. So we have a tremendous amount of work to do in a short period of time. And we did have an unfilled employment specialist. We need to fill that now so they can help and we can get people up to speed and do our first certifications for the 225 approximately.
Move it.
Root will second.
Any questions? Anything else you wanted to add, Don?
I have a question.
Yes.
Don, thank you for the explanation. What's going to be the requirements of the county to help these people find jobs or the work requirements?
We will be having a meeting later on with Rita's staff at Employment and Training, but we do ABOD requirements now for TANF individuals. It'll be very similar to that. We will let them know where they can go apply. We'll show them how to use the internet and search for jobs. Or if they are seeking an exemption, we'll help them. We need this paperwork from your doctor, or maybe you're on disability because of a accident and you're receiving something from like a private insurance company or something like that.
Don, are you going to have enough staff to do this in the time frame that you have to meet?
We have great staff down there. They all work very hard. We have a lot to do with limited amount, and we're all hands on deck, so.
All right, any other questions or ask Mr. Healy?
What's, do you know the total number of people that are on SNAP benefits in the county?
Total individuals receiving SNAP benefits are 5,250 people as of last month.
That's an awful lot. Now, I didn't realize, I was in a fast food restaurant the other day, and I didn't realize, I don't normally go to fast food if I have to, I go drive through, but I had to go inside the other day, and they had decals on their windows saying that they were eligible for SNAP too. Is that so?
That's
I know
new.
every other store I go into, you go down the aisles and everything says SNAP, 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 SNAP. So I guess it's no wonder we got 5,000 and some on, under the former rules. Thank you.
Mr. Barnes?
Yeah, Don, overall, this new policies for, coming down that big beautiful bill, how is your staff handling that? Is it extra work? Is it look like it's going to make common sense, save some money? So I guess I'm just looking for your opinion of overall whether it's going to work out better for the county, better for the people, or not.
SNAP benefits are 100% federally reimbursed. They're actually issued by USDA, so we don't upfront the money like we do for other programs and then seek reimbursement for that. We do get reimbursement for our staff that works in the SNAP program. They all know that there's a lot of work coming. They're ready for it, and we're going to work through it the best we can.
Thank you.
Mr. Healy?
Yeah, the program, it seems to me, just from what I observed, you know, myself being out and about, it seemed like that program had grown quite a bit over the last few years. What would your estimation be?
I think it's increased a little bit, but SNAP is one of those programs we really don't look at that closely because it's 100% federally reimbursed. I know that, say for August last year, it was 5,245 people that were in there. And then the figure that I just gave you, 5,250 people, it's pretty consistent. I don't have data that goes back to like
5 years
24
ago.
or 23. I mean, I can get that if you would like that.
Well, you got enough to do right now. Maybe we can discuss that some other time.
Yeah.
I know where your office is. Thank you.
Mrs. Hanchett?
Yes, I guess the only question I have, I know we look at how many people are on SNAP, but there's certain eligibility requirements too. It's not just with anybody. And I'm sure there's some, as you pointed out before, there's fraud cases
Yep.
here and there, but there's also, with eligibility, a great need for it at this time. And is that the concern that you are trying to address?
We want to stay within the regulation, and we haven't had the final administrative directive out of the Office of Temporary and Disability Assistance yet.
Right.
We want to see people get the benefits that they deserve, and we also want to see them do the requirements that they now have to do, so.
Okay. Thank you very much.
Any other questions or comments? All in favor? And that's carried, and certainly, please tell your staff we appreciate this additional work for them and what they have to deal with. We appreciate it.
Thank you.
Thank you, Don. Is that it for today, Don? Oh,
Oh, I'm sorry.
yeah,
Yeah, okay.
just making sure. You're
I'm sure there'll
okay.
be more coming down the road.
Okay, thank you. And then we have appointment to the Citizens Advisory Council from Brenda Rigby-Reilly, Clerk of the Board.
Yes. Sorry. The chairman of the board plans to appoint Diana Pease of Wellsville to the remainder of a vacant 3-year term as a member of the Citizens Advisory Council to the Office for the Aging. And that's going to commence immediately and expire December 31st, 2026, and it is subject to confirmation by the board.
Can I have a motion for
Root will
that?
make that motion.
Healy will second.
Any questions or comments? All in favor? Aye. Thank you. She is already on the board and is a great addition, so thank her for serving. And any unfinished business today? Any new business? Go to the order. Motion for adjournment, please.
Root will make that motion.